Are you wondering what it's like to undergo a facelift? Or maybe you're thinking about it, or somebody you love is thinking about it, and you want to get more information. Well, I've got the answers for you on this video. Not only are we going to go over the actual process, we're going to follow a patient through it. My name is Dr. Anthony Youn, and I'm known as America's holistic plastic surgeon. I help health-conscious men and women look their best by teaching them a holistic approach to beauty. And today, it's all about the facelift. So we're going to talk about what is a facelift, who is a good candidate for it, and let's follow a patient through it. Let's start by looking at the patient first. Our patient is a 68-year-old woman who is coming in who does not like the droopiness of her neck and her jowling. So we are going to perform a lower facelift today. There's some of her jowls there to help lift her lower face and the neck and reduce the jowls. Also, if you take a look, she also has a fairly good size earlobes, so we're going to reduce her earlobes as well to decrease the size of them too. That does create a little scar going transversely across the earlobe. So let's head into the operating room and I'll show you our markings. So who is a good candidate for a facelift? Well, a facelift basically lifts what is sagging in the lower face and the neck. So if you're looking in the mirror and you always do this, then that's the solution for it. Now, if you're younger, if you're in your 30s or your 40s or even in your 50s, sometimes there are some non-invasive or minimally invasive options that are sufficient to help tighten that area up. But if things are really sagging, if you've got jowls, if you've got skin in the neck that's really hanging, then probably the only option is a facelift. Now, not everybody should undergo a facelift. Obviously, it's not for everybody. But if you're thinking about it, that's what it's going to treat. Now, the important thing to realize with a facelift is that it's invasive surgery and it creates permanent scars. And those scars extend around the ears. I'm going to show it to you on the marking prior to her surgery right here. Okay, here are markings for the facelift, and what we're going to do is I'm going to start by making some incisions around her ears, and they're going to extend behind the ear and down a bit in front of her hairline. This is a line of her jawline. I'm going to reduce her jowl. We're going to lift the skin all the way up to here, lift the skin up to here, and also reduce her earlobe. She's got a bit of a larger earlobe, so we're going to take a little bit of a pie-shaped piece out of that. Alright, we are all done with her facelift. You can see the neck looks much tighter, removed a lot of fat, tightened up the muscle. Also, she's got the little incisions around the ears. You can see there's that little scar of her earlobe, so reduce the size of her earlobe, and that should heal real nicely. And I look forward to showing you how she looks here in just a few weeks to a few months. So a lower facelift takes anywhere from 3.5 to 4 hours. Obviously, if you have it done by a different plastic surgeon, it can take anywhere from a couple hours to many hours. But in my practice, usually around 3.5 to 4 hours. Her surgery went very, very smoothly. Now in her operation, you may see we did a little bit of other things. I actually did some dermabrasion to her upper lip to smooth out some of those wrinkles. It's not like an eraser, it doesn't completely get rid of them, but it does help to soften them up quite a bit. I also utilize PRP with most of our patients. PRP stands for platelet-rich plasma. And basically what we do is we draw blood, spin it down, remove the platelets, and I spray that inside the surgical site to help decrease bruising, decrease the risk of postoperative bleeding. And I think it's something that really helps to add for a quicker recovery. The other thing that we do is I have a complete holistic pre- and post-op supplement system that we give to all of our patients. It helps them with their microbiome, it helps to potentially reduce inflammation, and the idea is to try to promote healing. So that's another big thing. So after surgery, she spent the night in the hospital. She had a little drain behind each ear. The morning after surgery, I removed her drain, and then a week after surgery, she came back for her suture removal. So those little stitches, most of them come out at 1 week. Most patients are driving within about a week and a half, and by the end of the second week, looking pretty good, going out in public, pretty much doing everything but exercising. I usually have them wait 3 weeks to work out. Now let's take a peek at how she looks several months later. Okay, we are now a couple months out of her surgery. She's healing really well. I'm going to have you look straight ahead, and let me just show here. She has little scars around the ears. They're healing really nicely. We also reduced her earlobe. Still a little bit swollen, and that's going to come down real nicely. And you can see she's got a nice sharp jawline, and everything has healed very well. How'd you do?
Did really well.
Did you have much pain with it?
No, it just initially, like the first hours of the first day, but really nothing intolerable. It was fine.
Good. Yeah, well, you look fantastic. Thank you so much.
So she is looking great a few months after surgery. Let's take an even closer look and let's take a peek at her photographs. So let's take a look at some photos of this patient. So this is her prior to surgery, and you can take a peek at her neckline. And this is her photo that we just took where she is about 3 months after. And you can see her neck is much sharper. She does have little scars around the ears. Those are healing really, really well. Now let's take a peek at where we did her upper lip. So I did the dermabrasion to the upper lip. There's some deep wrinkles there in her before picture. And here she is in the after. Things are just a bit smoother, so hopefully you can see that. It's not unfortunately like an eraser where the wrinkles are completely gone, but it does help to soften them up quite a bit. We'll take a look at a different angle here. And this is the other angle, and you can see how that skin looks so much nicer afterwards. So that's the wrinkles and the looseness before, and here she is afterwards. I mean, it really looks like a new woman. So I'm real happy for her. Getting such a nice result. So the swelling can take 4 to 6 months to completely go away, and that varies depending on the patient. The scars can take 6 months to 2 years for them to completely mature, so that can take a while. And keep in mind, those scars are completely permanent. You'll always have them if you have a facelift, but hopefully they fade with time and look better and better. If you're interested in learning more about facelifts, check out this next video. It's everything you need to know about facelifts to give you even more great information on this good operation.